Well, let's now turn our attention to how data and digital tech is helping to bridge the gaps in healthcare provision and accelerate progress in Africa's healthcare sector. Well, a company called Field Intelligence is helping African governments to supply pharmaceuticals and immunizations more efficiently and improve the availability of life-saving medicines. They're using technology that optimizes ordering and warehouse distribution, but also helping to create much more visibility and transparency across donor programs. Well, let's get into the technology with Justin Lorenzen. He's the Chief Technology Officer at Field Intelligence. Great to have you with us today on the show, Justin. And let's start off with the solution that Field Intelligence is offering here on the African continent in markets like Nigeria and, of course, Kenya. Now, your company basically takes over supply chains and inventory management processes. Give us some insight into how this digital tool works for healthcare institutions and African governments. What level of the supply chain do you come in? And of course, how are you improving these supply chains?
Yeah, thanks and good evening. It's funny you should ask that about the levels, actually, because over the years, we've actually found ourselves working at all levels of the supply chain. Our start was with community health workers and pharmacists who often struggle with the very information-heavy task of supply chain management, and are often armed with nothing more than a smartphone and an unreliable cell connection to do it. I have to manage hundreds or thousands of dollars of life-saving commodities. So we realized that tech had a role to play here. Supply chain systems are largely information systems, and what matters first and foremost is visibility into where the stock is and where it isn't. So we realized that if we could simply provide some tools which worked on that phone in the health worker's back pocket, then we'd have the basis for a system that could help everyone in the supply chain from the top to the bottom. So that's how our product, Field Supply, was born. And 6 years later, and in part thanks to a real effort from the Nigerian government to pull together partners and programs around a consolidated supply chain, we now support 5 national scale programs here, including HIV, malaria, family planning, maternal, newborn, and child health, and tuberculosis. And that's across some 35,000 facilities, hospitals, labs, and private community pharmacies, and now support everything from inventory management to planning, procurement, fulfillment, and financing through our service for private pharmacy called Shelf Life.
Hmm. Well, let's talk more about how you're helping to bridge that gap in the healthcare sector in Africa using data. And we know you have about 5 years of data in markets such as Nigeria. So tell us more about the role that data has played, certainly in helping to optimize your operations and better understand the markets you're in and, of course, improve these sectors.
Yeah, that's a really interesting question because obviously there are a great many players in supply chains this large, but we've at least been able to contribute to some really significant achievements here in the programs that we serve just by providing visibility and some often not even too far out analytics. So, for instance, at the time that we've been active here in Nigeria, we've helped reduce the frequency of stockouts for anti-malarial drugs at the point of care by, I think, around 52%, and for modern contraception by 57, 58%. So in other words, Field Supply has helped more than double the likelihood that patients seeking these really important products will be served when they go and show up at a clinic or a pharmacy. And the 5 years of data that we've got now show that we've helped the government of Nigeria identify and avert up to about $2 million in losses that would otherwise have occurred due to expiry simply from supply chain best practices, identifying first expiry products to distribute. And I guess lastly, I would just say that in the private sector, we're collecting very granular data, very granular demand data, which, as far as we're aware, is pretty unprecedented in the market, in the markets that we serve. And they're really helping us build some next gen products and helping partners and our other collaborators explore new financing models and supply models, dynamic pricing and planning, and risk assessment kind of thing.
Mm. And the tech is moving quite fast because your tech is currently being used in more than 700 pharmacies across Nigeria and Kenya. One of your products, Field Supply, it's in about 35,000 healthcare locations right now. So what are your plans to expand these services further on the continent?
Well, I mean, we are very impact driven. We believe that medicines should be available and affordable everywhere across the continent. And, very specifically that strengthening how supply chain is managed and financed is critical to achieving that. So starting in Nigeria and Kenya is a fantastic foundation. We certainly learned a lot, and it's very clear that field supply and shelf life address needs that are shared across the continent. I mean, it might be a bit cheesy to say, but ultimately we'd like to be helping anywhere someone needs to find some life-saving commodities on a shelf. We'd like to be there helping.